Hi everyone, in this video we are going to see about Glasgow Coma scale. Myself, Julian Thomas, faculty working in Triplum College of Nursing. The objectives of this session include the group should be able to define Glasgow Coma scale, enlist the components of Glasgow Coma scale, brief the interpretation of Glasgow Coma scale, enumerate the limitations of Glasgow Coma scale. What is a Glasgow Coma scale? This Glasgow Coma scale, otherwise it is known as GCS, is a tool used to assess and calculate patients' level of consciousness. The Glasgow Coma scale, it's a neurological scale which aims to give a reliable way of recording the conscious state of a person. The GCS is used to describe the general level of consciousness in patients with traumatic brain injury and to define broad categories of head injury. The Glasgow Coma Scale, or otherwise it is known as GCS, it is divided into three categories. The first category is known as the eye opening. It will be mentioned like E, the motor response M, and the third category, that is the verbal response V. The GCS uses a triple criteria scoring system, which is the best eye opening. The maximum will be 4 points, and the second one is best verbal response. The maximum point will be 5 points, and the third one is the best motor response, and the maximum points will be 6. These scores are added together to provide a total score between 3 and 15. The score is determined by the sum of the score in each of the three categories with a maximum score of 15 and a minimum score of 3. This scale was published in 1974 by Graham Tisdale and Brian J. Jennett, the professors of neurosurgery at the Universities of Glasgow Institute of Neurological Science at the City of Southern General Hospital. A patient is assessed against the criteria of the scale and the resulting points give a patient score between 3, which indicating deep unconsciousness, to 15 with a full consciousness. As we discussed earlier, the components of the GCS include eye response, which will be scoring between 1 and 4, the verbal response, which will be scored between 1 to 5, and the motor response will be scored between 1 to 6. So these are the three components included in a Glasgow Coma scale. So based on the response to each, the patient will be scored between 3 and 15. So to explain in detail about this GCS scale, the first component is eye response. So how the eye response will be marked? So if the patient has no response, no eye response, it will be scored as 1. If the patient is having an eye response to painful stimuli, it will be scored as 2. If the patient is having an eye response to a speech or to a verbal response, then it will be marked as 3. And if the patient can open his eyes spontaneously, then it will be marked as 4. So the eye response will be scored from an scoring from 1 to 4. So if the patient is fully conscious, they will get a score of 4, and if the patient is unconscious, they will get a score of 1. And the second one is the best verbal response. So here the verbal response of the patients will be assessed. If there is no verbal response, it will be scored as 1. And if the patients produced any inappropriate sounds, so that will be scored as 2. And if the patient will have some inappropriate words, so that will be scored as 3. And if the patient is totally confused, then it will be marked as 4. And if the patient is oriented to time, place and person, that is fully oriented, then it will be scored as 5. So this verbal response will be scored between a score of 1 and 5. And the third category is the best motor response. Here the patient motor strength will be assessed. If the patient is having no motor response, then it will be scored as 1. And if the patient is having an abnormal extension or there will be decerebration of the extremities, then it will be scored as 2. And if there is an abnormal flexion or decortication, then it will be scored as 3. And if there is a flexion or withdrawal from the pain stimuli, then it will be scored as a 4. And if the patient moves his extremities to a localized pain, then it is marked as 5. And if the patient obeys commands, whatever the examiner asks, if the patient obeys to the command spontaneously, then it will be marked as a score of 6. So the best motor response will be marked between a score of 1 to 6. So the total score of GCS will be between, the score will come between 3 and 15. So if the patient is totally unresponsive, the score will be 3. If the patient is a comatose client, it will be 8 or less. And if the patient is having score more than 8 and 15, best response. So these are the scoring system of a GCS scale. So to see in detail this eye response, there are four grades starting with the most severe, that is the grade 1. Here the patient will not have any eye opening. No eye opening will be graded as 1. So score 2 will be given for an eye opening in response to painless stimulus. For example, a peripheral pain stimulus such as squeezing the lunula area of the patient's fingernails, which will be more effective than a central stimulus such as a trapezius squeeze due to the grimacing effect. And the score 3 will be given for an eye opening to speech. So this should not be confused with the awakening of a normal person from a sleep, such patients will receive a score of 4, not 3. And then 4 is eye opening spontaneously. So in regard to verbal response, there are 5 grades starting with the most severe. Grade 1 will be given to no verbal response, and the second grade 2 will be given to incomprehensible sounds like mourning. The patient will be mourning, but there will not be any words. And the third score will be given to inappropriate words, for example, random or exclamatory articulated speech, but no conversational exchange will take place. So here the patient speaks words, but there will not be any sentences. And the fourth one is confused. Here the patient responds to questions coherently, but there is some disorientation and confusions will be there. And the fifth is fully oriented. Here the patient responds coherently and appropriately to questions such as patient name and age, where they are, why, and the year of month. That is, the patient will be oriented to time, place, and person. So with regard to motor response, again here the first score will be given to no motor response, and the second score will be given to a decerebrate posturing, that is accentuated by the pain. There will be an extensor response, that is adduction of the arm, internal rotation of the shoulders, and pronation of forearm, and there will be an extension at the elbow, flexion of wrist and fingers, leg extension, and there will be a plantar flexion of the foot. So this will be considered as a decerebrate posture. And the third score will be given to decorticate posturing accentuated by the pain. So here the patient will have a flexor response, internal rotation of the shoulder, flexion of forearm and wrist with clenched fist, and the leg will be extended, and there will be plantar flexion of the foot. So this posture is mentioned like decorticate posture. Score 4 will be given to withdrawal from pain, that is absence of abnormal posturing, but the patient is unable to lift the hand past chin with a supraorbital pain, but does pull away when the nail bed is pinched. And fifth score will be given to localizes to pain. So that is powerful movement towards painful stimuli will be there. Example, bringing hand up beyond the chin when supraorbital pressure is applied. And the score 6 will be given to obey commands. That is a normal commands the patient will have, that the patient does simple things that we asked. So this is about the motor response. Coming to the interpretation of GCS scale, the three responses are measured like the best motor response will be given a maximum score of 6, and the best verbal response will be given a maximum score of 5, and the best eye opening will be given a maximum score of 4. So the total score will be 15. So how this brain injury will be classified based on the GCS. So if the GCS is less than 8 to 9, so that will be considered as like severe brain injury. And if the GCS is 8 or 9 to 12, so it will be considered as moderate head injury. And if the GCS is more than or equal to 13, then it will be considered as like a minor head injury. So the head injury will be classified based on this GCS scale. So here if the patient is alert, then they will have a score of 15. If the patient is responding to verbal stimuli, then they will get a score of 13. And if the patients respond to stimuli, then they will get a score of 5, and unresponsiveness will be marked as 3. The lowest score of each category is 1. So therefore the lowest score will be 3 if there is no response to pain, no verbalization or no eye opening. So when we calculate it together, the score will come 3. And a GCS of 8 or less indicates severe injury, one of 9 to 12 with moderate injury, and a GCS score of 13 to 15 is obtained when the injury is minor. So there are certain limitations to this GCS scale. So the limitations include if the patient is having a tracheal intubation, and if the patient is having severe facial or eye swelling or damage. So In that case, it is impossible to test the verbal and the eye response of the patient. So in that case, it is very difficult to assess the patient condition using a GCS scale. So in these circumstances, the score 1 will be given with a modifier. That is, if the patient is having an ET tube or if the patient's tube is connected to a ventilator, in that case, a score of 1 will be given. So the GCS is again limited to this applicability to children, that is especially below the age of 36 months, where the verbal performance of even a healthy child would not be expected. So we cannot even assess a patient using this GCS scale in these two situations. So to conclude, in practice, the GCS is one part of the neurological examination even in unconscious patient. It is also important to assess pupil reactivity, fundai, and the brainstem reflexes, limb reflexes, and signs of meningitis and plantar response along with this GCS to rule out any other conditions which is associated with the neurological system. Taken together, the examination findings may help to localize a neurological lesion. As part of regular observation of an inpatient, it is important to note the trend of GCS score. What is the trend? Whether it is deteriorating or whether it is improving. So a decrease in score by just 1 or 2 points could represent neurological deterioration and may necessitate urgent brain imaging. Thank you.